You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment for people that have thyroid conditions. We're specifically talking about low thyroid or hypothyroidism. With us, we have Dr. Ott. Dr. Ott, welcome to the program.
Thank you very much. Good to be here.
Now, your center, Integrative Health of Orlando, and you have a thyroid program. And why don't you tell me, for people that don't know you, we've had you on the program before.
Yeah.
You have kind of three programs under one roof. Tell me a little bit about it.
Right. In our clinic, we have an integrated setting where we work with physicians from all different backgrounds, as well as allied professionals. We all work together really on three specific things. We work with diabetics, we work with patients who are suffering with hypothyroidism or low thyroid, and we work with patients with peripheral neuropathy.
Okay, good. Now, with the thyroid program, how big of a problem is having a low thyroid? And what are the symptoms? Define it if you can for me.
Well, for the person suffering with it, it's a huge problem. This is the master gland in the body, really. Next to the pituitary, this is really the next thing down line that does almost everything else. So these people are affected dramatically. A number of different symptoms, from brain fog to losing their hair, to brittle nails, to dry skin, to low sex drive, to digestive disorders. You name it, really, these people start suffering from it because, again, that thyroid affects everything.
Now, for metabolism, like people trying to lose weight.
Yeah.
Direct connection there with low thyroid?
Yeah, absolutely. These people struggle with, they literally can do everything right that a normal, healthy person would do and not lose a pound.
Is that right? Have you had people that struggled their whole life with weight and, with testing or whatever, that turned out that they had a low thyroid?
Yeah, all the time.
Really?
It's one of the real, major symptoms that these people come in complaining about. I eat perfectly. I follow a very specific exercise regimen. I do all of these things, right on T the way that I should, and yet not only do I not lose weight, I keep gaining weight year after year.
Okay, so who is the typical patient? Because when I initially heard about your program, we invited you on the program, I thought you were giving people thyroid medication.
Right.
But you're not. These are for people that usually are already taking thyroid.
Yeah,
is that right?
Correct. Yeah, the patients.
So who is the patient?
The patients that we're seeing have already been diagnosed as being hypothyroid or low thyroid, generally taking thyroid medications at this point already. And what's happened is, in spite of taking the thyroid medications, they still continue to suffer with the same symptoms. So they're taking their thyroid medication. Their lab results now are telling the doctor that their TSH level is normal, which is the key marker that we look at.
What's TSH?
Thyroid stimulating hormone.
Okay.
So their thyroid stimulating hormone is normal, in normal ranges, yet they still have all the same symptoms that they had before. So they get told everything's good, everything's normal. And they're sitting there saying...
They don't like hearing that, obviously.
Yeah, they're frustrated, as you could probably imagine, because they say, well, that's great, that lab result says that everything's normal, but I still feel like garbage.
So the traditional approach, just so I understand, the traditional approach for thyroid, take a test, and you're told you have low thyroid, you're given thyroid medication.
Yes.
And that's it? Do I have it somewhat
Yeah,
close to what?
Typically, and in fairness, that's needed. Right? If the thyroid is underperforming, it's not producing enough thyroid hormone, and the TSH level is elevated, basically what's happening is you've got the gland upstream that's producing thyroid stimulating hormone telling the thyroid, make more, right? There's not enough, make more. Those people need to be on thyroid medication typically. But that doesn't fix the cause of the problem, It deals again with the symptom. It gives that artificial boost to the system, puts the thyroid hormone in place that's necessary. TSH level now normalizes because it says there's enough of it in the system.
Okay.
Patient still has all the same stuff going on.
So what do you do that's different then? What do you do for that?
We really take the same approach with these patients as we address with all of our patients, and that is that we say, one, what are the triggers? What are the things causing the problem? What's at the root?
Like what's making the thyroid not work properly?
What's either making it not work properly, why is it underperforming, or most commonly, what's attacking the thyroid? What we know from most of the research now is that in America, the vast majority of patients suffering with hypothyroidism are actually suffering with an autoimmune disease. So they're being treated.
Interesting.
They're being treated as thyroid patients because that's essentially the symptom. That's the thing that's showing up on the surface. But really what's going on is they have an autoimmune attack that's happening where their own bodies are essentially destroying the thyroid gland.
Okay.
And that
what is that autoimmune disease?
It's called Hashimoto's disease. So a Japanese medical doctor discovered this years and years and years ago. It's not a new thing. But the reason it really doesn't get addressed is that whether you're diagnosed as being positive for Hashimoto's or not, TSH is the king. And if TSH is normalized by giving thyroid hormone, then everything is fine in the normal model.
So you think it's being misdiagnosed, this Hashimoto's disease?
It's not even that it's being misdiagnosed. It's not even being really looked for in most cases. You know,
I spoke to one of your partners, one of the doctors, and Dr. Carter, and she says that about 90%, 80-90%, I think is what she told me, of the patients that come in that are already on thyroid have this Hashimoto's disease.
Right.
Are those your findings as well?
Yes, that's exactly right.
So there's a biological marker, that says, okay, you have this immune disease.
Correct.
That's affecting your thyroid.
There's a couple of them.
Interesting. Very
There's
interesting.
a couple of tests that we run. We run one that looks at what's called TPO antibodies, and another one that looks at what's called thyroglobulin antibodies. And essentially, you shouldn't be making antibodies to your own tissues, right?
Okay.
This is what these indicators show us. They tell us that you're attacking yourself, essentially. Your body is recognizing your own cells as being foreign invaders and going after them. And so if that's going on with a thyroid sufferer, it's one thing to give the thyroid hormone that's necessary to get their levels up, but if you don't deal with that underlying issue, that attack, this is why these patients continue to suffer with all the same symptoms.
Is this in the literature? A traditional medical doctor, obviously, that's doing it the other way.
Yeah.
Why aren't they looking at this?
Is
it in the literature?
Absolutely, yeah. It's all over the literature.
So this is all science-based, what you're doing. You're
Correct.
not the only one, I should say respectfully.
Absolutely not. Okay. This is all over the literature. The issue is that, again, then what's the treatment, right?
Okay.
What would you do different? And in a traditional model, there's nothing that you would do different, so why bother looking at it?
Just treat the particular blood value or whatever of thyroid.
Exactly.
Interesting. Okay.
Exactly.
But do you see reversals, people that were taking thyroid with all the symptoms, and then when you address this underlying issue that they're better?
Yeah.
Those symptoms go away?
Yes.
And is that common?
All the time. All the time. So these patients come in saying, my doctor tells me everything's normal, but I still have XYZ. I still can't focus. I can't spend time with my kids. I can't remember new people's names. And
really?
Very, very quickly, these things start to change. Their hair stops falling out. Their skin gets back to normal. So, and it doesn't in most cases take very long for these people's symptoms to start to get better. They change quickly.
Is it eventually reversed? This Hashimoto's disease, does it go away? Is it kind of like your type 2 diabetes where it's gone in a way?
Here's the thing about autoimmune disorders is once the body recognizes cells that way, it's always going to recognize cells that way. And so what we have to do is we have to calm down the things that trigger that response over and over again. Essentially what we look to do is put it into remission.
Okay.
Quiet down the system.
And you do that all the time?
Yeah. And we see that in the labs all the time. We see people come in with those antibody levels that are through the roof, and within a very short period of time of treating them effectively with the right tools, those levels come down, 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 down until we see that there's not really a mounting attack.
How big of a problem is low thyroid, by the way? Is it in the millions?
Yeah, it's huge, with females in particular. It's a huge, huge problem.
So females get it more so?
Yeah, far greater predominance in females than in males.
So how do people hear about your program? Obviously, programs like this, but are there like ads in the paper, on the internet? They go to your website, word of mouth?
Yeah, they find us in all of those ways, but they really find us mostly by starting to actively look for something more, because they get so frustrated hearing over and over and over again that everything's normal, Nancy. These patients start to get told, look, it's all in your head.
Really? People have said that?
Yeah, they come in and tell us this. And these patients come in and tell us, last time I was at my doctor, he said, look, Nancy, everything's fine.
On your blood work.
I'm looking at your blood work, everything is fine. This stuff's in your head. It's not real.
Really?
But they know very well, living in their own bodies, it's real. And if you get 10 of these women together, they'll all tell you the same thing.
That
the symptoms are very real. They're not imagining their hair still falling out. Okay, they're not imagining brittle nails.
I've asked you already before, but there's people that are suffering, people that are depressed, no energy, lethargic, can't lose weight the way they used to.
Yeah.
And you see reversals in these all the time.
Yeah.
What do they say? What do they say to you? Are they frustrated? Like, Why didn't my standard medical doctor, and I know you want to be positive, you don't want to say anything negative about anybody, but are they sometimes frustrated?
They come in frustrated and quite frankly, fairly prickly a lot of times. These are people who have been, kind of put aside a lot of times in their previous care. No one wants to really listen to them anymore because
their blood work, you say, fine.
Right? And they're just sick of hearing about this patient who says that stuff's still wrong, even though all their labs say that they're normal. And they're frustrated. They're angry sometimes. But
when they get better, are they angry as well? Going, why did I suffer for so long? Does that ever happen?
Oddly not.
Okay.
They're usually in a pretty happy, thankful place at that point. The thyroid function affects mental function dramatically. And so these patients are depressed. They have all the things that go along with that many times.
Oh, really?
And depressed people who are overweight and are feeling terrible don't tend to be always the folks you want to be around all the time, right? And so a lot of times doctors don't want to deal with these people. They just don't want to deal with these patients because they're, quite frankly, they're not your favorite type of patient. We love working with them because we know that we can watch that person come in a little bit prickly, a little bit rough around the edges, and within a matter of a few weeks, that starts to completely change. Our staff will comment, that so-and-so was, just started care 2 or 3 weeks ago. I can't even believe that that's the same patient now. They're actually nice to me, and they have a smile on their face now, and they were so argumentative and difficult before. So these patients literally change their lives. I have husbands who will literally just come in for a visit, no other reason other than to just say thanks.
Is that right?
Thank you very much for delivering the woman that I loved back to our family, because she was impossible to live with, and she didn't enjoy spending time with the children, and it creates difficult family dynamics. Look, anybody who feels terrible all the time is bound to have that come out and take it out on other people sometimes, right? We've all been there. Well, imagine feeling like that all the time, every day for years on end.
Do you think what they do is just self-diagnose? The patients just think, well, it's just part of aging. It's part of menopause. It's part of whatever.
Yeah, I think some do. I think a large number of folks do. Just chalk it up to common, There's a big difference between common and normal. Unfortunately, patients live with a lot of stuff that has become common for them, when it's in fact not normal at all. It's just become part of their life, their routine. They get used to it. So if you're having these kinds of symptoms, that you're saying I'm not me anymore. I'm not the person that I was. Something's different, but nobody's really finding it.
Does it seem to happen right away? All of a sudden?
No.
Like what you describe, I'm not me anymore?
It doesn't. That's, I think, the tricky thing, right? It happens over time, where these patients sort of slowly become someone other than who they were, and they don't really understand why. They have the short trigger now. They get angry and frustrated really quickly, and they say, that's not me. I was never like that. Great example. I had a patient, young lady, about 27 years old. She apparently was the life of the party before with her friends in years past. Has had thyroid problem for 3 years. 3 years later, she's now the one who avoids going out with her friends. She tells us, I don't go out with anyone.
Because of her energy levels?
She has no energy to do it.
Motivation?
When she does muster up the energy to go, she goes there and she doesn't have any fun, right? She doesn't enjoy it because she's exhausted. She's pretty short. Her friends aren't really enjoying spending time with her. So she comes back a few months into care and says, my friend said you gave them back their friend. I can be social again. I can go out and do the things that I love to do, and go dancing and go enjoy an evening out with my friends. And so
back to the treatment though. So if 90%, 80%, 90%, I think you said, have Hashimoto's disease, these people are on thyroid and they're not getting better, then, help me understand a little better of what it is. Again,
sure.
Hashimoto's.
So the thyroid gland is a small gland at the base of the neck, base of the throat, really on the front. That gland is stimulated to release thyroid hormone, T3 and T4, by the pituitary gland. So the pituitary gland is a gland up in the brain. It releases TSH, thyroid stimulating hormone, which then makes the thyroid make its compounds. Those compounds then go out into the system to do what they're supposed to do. They really drive all these other metabolic processes in your system. What Hashimoto's essentially does is it starts to recognize the actual thyroid cells, the tissue itself, as foreign, and it starts to attack and destroy it. And so you actually have thyroid tissue destruction happening with these patients. And it literally is an autoimmune disease, just like something like MS, for example, where your body is attacking your own nervous system.
So you do food sensitivity or food allergy testing on these patients?
We do. When necessary, absolutely.
And you usually find food allergies, food sensitivities?
Commonly, yeah. In most cases, I would say there are some. Gluten's a big one. You know, it's one of those ones that we're hearing more and more about nowadays. You know, it was something that no one ever heard about 10 years ago. We're hearing more and more about gluten sensitivity, gluten allergies now.
So on these people that actually show a gluten intolerance or gluten problem, when you pull it out, when they stop the gluten or the bread,
right? It's like
they get better?
It's like pulling fuel off a fire. Okay. Right? If it's one of the major drivers, if it's a major trigger, you take that out of the diet.
So you're saying that the gluten, if they're allergic to it, I just want to make sure I'm understanding this correctly, will affect the immune system. The immune system then will attack the thyroid.
Exactly.
Am I getting it?
Yes.
Kind of? Okay.
It activates that immune sensitivity. So it passes through the digestive system. Once it gets past that barrier and into the actual body, the body sees it, starts attacking it, and then mounts an attack against other tissues.
Okay, so you do some sort of an elimination program for things that they're allergic to.
Yeah.
Okay.
Absolutely.
What next? What else do you do?
We run comprehensive testing to find out exactly what's going on with the digestive tract. Okay. You know, leaky gut, or basically a digestive tract that allows things to pass through it that it shouldn't. Proteins, for example, can be a major trigger as well. These patients are triggered by adrenal problems, so stress hormones, right? If their stress hormones are overactive and being dumped into the system, it drives blood sugar, and blood sugar is another trigger.
And how common is this adrenal problem, adrenal fatigue, I guess, with these people with the thyroid condition? I mean,
very common.
Really?
Because there's a couple of things that go hand in hand for females that have thyroid problems. One of them is polycystic ovarian syndrome, or PCOS, you hear it commonly referred to, which is a hormonal imbalance. With that problem boils down to, in large part, blood sugar dysregulation for women. Blood sugar dysregulation drives the PCOS, and that kind of issue will be pushed along by food, obviously, right?
Okay.
I mean, if the food you're eating is driving your blood sugar, which is driving the adrenals, which is driving the PCOS, which is driving the thyroid problem, you know, you start.
So these are stress hormones, and when you say adrenal, adrenaline, these are stress hormones.
Right. Cortisol being one of the big ones.
So what are other things that could affect thyroid?
Nutritional issues, for example, iodine. A lack of iodine can definitely cause thyroid deficiencies.
I mean, isn't that one of the big problems is iodine? I mean, if you take iodine, it helps?
Actually, that's a big misnomer, because
Really?
most of the research now is actually showing that, especially in a Hashimoto's case, if you're an iodine deficient thyroid sufferer, then that's the fix, right? Simple fix. Take iodine, fixed. But if you're a Hashimoto sufferer, taking iodine, especially taking large amounts of it, which is what we find a lot of these patients coming and doing, actually is activating the problem even more. It's a driver.
Is that right?
And so with a lot of these folks, you got to take them off the iodine. We got to tell them, like, you got to stop doing that. Not only that, you got to stop eating foods that are rich in it as well.
We're going to take a quick break and more about the process and what people can expect. And I want to know also the frequently asked questions. Okay, so they're taking thyroid. I want to know what they're asking you on day one. Frequently asked questions. You're watching the Wellness Hour, leader in medical news information. I'm Randy Alvarez. We're talking about new treatment options for people suffering with low thyroid. We'll be right back. I'm Randy Alvarez. You're watching the Wellness Hour, leader in medical news and information. We're talking about low thyroid and new treatment options for people suffering with hypothyroidism. Am I pronouncing it right?
You are.
Okay, what do they
Well
call
done.
it? They just call it low thyroid?
Yeah, I think commonly, because hypothyroidism is a mouthful, I think a lot of folks just call it low thyroid, and I think it's a great term. It's really better descriptive, I think.
Now, you're in Orlando. Okay, so you work, for people just tuning in, work with a team of doctors. We're talking about thyroid. You have a program that's specifically for thyroid patients.
Correct.
Okay, and who's the ideal patient? I mean, who do you want to attract? And who would you like to see more of? I mean, who's perfect for your program?
The ideal patient is the patient who has been diagnosed, has gotten onto thyroid hormone, and is still having all the same symptoms they were prior to being put on thyroid hormone. So in spite of the fact that their thyroid levels are now where they need to be, and their thyroid stimulating hormone levels are where they need to be on their blood work, they're still having all the same symptoms that they were having before.
Okay.
That's really the perfect patient. Those are the patients that...
So you don't take them off. You don't wean them off thyroid.
No.
You just...
Absolutely not.
Together with their medication, support their thyroid function.
Yeah,
Is that right?
Support their thyroid function, but also calm their system down.
Their immune system.
Correct.
Okay.
Exactly. That's really the key. I mean,
What does that mean, calm the immune system down? I'm not sure if I understand that correctly.
The immune system is, think of something simple like a fire, right? And the fire's got to burn. I mean, you want that warmth, you want all the things that go along with the campfire. You want an immune system, and you want it to work, right? Okay. But what you don't want it doing is you don't want it getting out of control and setting the whole forest on fire. Okay. And that's really what we're talking about when we talk about an overactive immune system. We don't want it being triggered and activated to start now destroying your own cells, right? We don't want it attacking your own body parts and starting to destroy those. And that's what Hashimoto's does. And we have to really deal with this disease as an immune system disease and not just a thyroid disease, which is how it's being looked at and treated in most cases. When we deal with it as an immune system disease, we can really take the fuel off the fire, take your foot off the gas pedal and slow it down. What we see is all the symptoms start to dissipate. The veil sort of gets lifted. And these people start to see blood work that looks
first?
normal.
I mean, what happens first, by the way? Is it more energy? Is energy the first one?
I would say the two most common things that we hear are the energy level starts to come back and the brain fog starts to lift. These people have such a difficult time focusing like they used to. They just can't get their mind to focus on things and just stay with daily tasks that you and I would take for granted, that we can do without even having to think about.
Is that right?
We have a to-do list and we can just keep it in our mind, right, and get it done. This patient has to have a to-do list that has everything written down
Walking around with the to-do list.
And they have to go back to it like 10 times a day because they can't remember what the second thing was.
Is that right? So that goes on. Obviously, this is not something we hear about because these people kind of don't let anybody in on it, right? Except for the doctor. It's very interesting. So this goes up. So the brain fog. Yeah. And are they diagnosed as just depressed?
Most of the time.
Hormonal, as they say?
Many times that can be the case. The biggest way that this disease plays out for them is in their families. Because it affects women.
Okay.
Because it affects women so much. And usually women who are in their 30s to 40s when it comes on, these are women that have families. These are married women with children. And their families are the ones that really suffer the most with it. Not that the patient's not suffering, of course, as well, but everyone in the family unit is affected. They don't maintain the same relationship with their spouse that they used to. They don't maintain the same relationship with their children that they did before either. And so the most common things we get feedback on are those things. The brain fog's lifted. I can think clearly again. I don't have such a short fuse anymore. My children don't drive me crazy.
Okay, so they're less agitated. I guess.
Exactly.
Okay. Now, and are there, and how long, and by the way, because you say it's insidious or that it happens, it's gradual.
Yeah.
But you get them usually in their 40s.
Yeah.
When they're coming
I would say mid-30s to mid-40s is the most common area where we're seeing these women show up in our practice.
And some of the best scenarios you've seen, people that are miserable, no energy, edgy, all of the things, brain fog. I mean, a week into it, 2 weeks, a month?
Yeah, we have patients who
they start feeling better is what I'm...
Within a week, come in and say, I don't know what you did, but keep doing it.
I mean, for some people, is it like a miracle, as they say, I got my life back kind of a thing?
Yeah, that's exactly it. Imagine if you're a woman who over the last 5 years has gained 60 or 70 pounds, right? Can't lose it. No matter what diet you go on, nothing ever comes off. You're arguing with your husband all the time. There's no marital intimacy anymore. You're short with your children. And
oftentimes this is a thyroid problem.
That's
triggered by
not being
Hashimoto's disease.
Yeah.
Really?
So, when you can start peeling that stuff back, and within a few months you now have a mom who's lost 20 and 30 pounds and is continuing to lose weight, and she's no longer in that dynamic with all the people around her, and she feels good again. She feels good about herself. It changes lives, not just the patient's life, but the lives of the people around them that they live with and interact with.
Final message, though, and we're out of time. Great stuff. Somebody watching this, okay, so they have the symptoms of low thyroid or they're on thyroid medication. They still feel lousy.
Yeah.
Lack of energy, can't lose weight the way they used to. What's their first move?
First move is to call and set up a consultation.
Okay.
every doctor-patient relationship starts with that interview, right? That sit down together and tell me about your history. Tell me what's been going on.
And they don't have to switch doctors. I mean, their medical doctor is their medical doctor. You guys are working together, though,
right.
with going to the underlying cause of this other issue.
Right. Yeah, we're not looking to become people's primary care physicians for, their every chest cold and ill that they have. These are patients who come to us specifically for help with this issue.
Okay.
They want help with just that one thing. And that's really what we do, is we deal with that one thing. And we work hand in hand with their physician, if that's what they want, or we work in-house with the physicians that we have on our team that are able to manage that whole thing. So, it's patient-driven, it's patient-focused. Identify what's going on with that patient, do all the testing necessary to get to the bottom of it. And once we understand what's going on, what's triggering, what's driving the problem, you eliminate the triggers and drivers, and then you support the system.
Okay.
You support the system with whatever's necessary to get that person back to a place of health and wholeness.
Okay, great. Well, I want to thank you for coming on the show. Great stuff. Great info.
Great being here. Thanks for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Just put in low thyroid, or you could put in Dr. Ott. You can see it again. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.